everyone. Welcome again to Leaders Uncut. It's so great to have you with us today. And today it is my great pleasure to have with us Shivastuti Koul, who is the founder and CEO of the AetherLoop.com and who is doing some extraordinary things with AI and emerging tech. I can't wait for her to share her story. Hello, Shivastuti. How are you doing today?
Hi, Catherine. I'm good. How are you?
I'm good. So good to have you here. I'd love you to give us a little bit of a background on yourself. I mean, you obviously you've spent years working across software engineering, product management, and accessibility. So, can you tell us maybe a little bit of a background, and then what drew you to technology, that career path, and then why did you create the Everloop? I know it's a lot of questions, but
First of all, thank you so much for having me.
yeah.
I have been in tech for close to 15 years now, almost 15 years now. And I first actually started at the age of 15, where just I disintegrated one of those clunky CPUs that we used to get back in those times. I disintegrated that completely. Even my father
Wow.
bought the first PC for me just to see what was inside. So I think that was everybody got a hint that, okay, she's destructive. So let's channelize that somewhere
Yeah.
where it would be beneficial. But yeah, I've been lucky enough to work on initiatives that I've always been passionate about, be it as a software engineer or as a technical program manager. And I've consulted for a bunch of different startups as well. And it just makes me really happy to create technology that can change people's lives in some way. Um, and yes, I've worked in some great brand names in the industry, but what I really took away from all of that was that I need to keep building something new. Because one of the things that I worked on was the Xbox adaptive controller at Microsoft. And that experience in itself for me was like, I think I need to keep building new ideas so that and I have ADHD, so it just keeps me more engaged and keeps me more entertained all the time.
Yeah.
Why AetherLoop particularly? It stems from a very personal story. I had been living my life very dandily up until 2023. And that's around that time, a little before that, I had actually met my now fiance, and he is a functional medicine coach. And I thought I lived a really, really healthy life. I'm a vegan. I ate minimally outside. But he pinpointed a few things in my life that were attributing to chronic backaches because I was used to living with it. I thought that it was just, how people in tech get these professional injuries,
Yeah.
carpal tunnel and backaches and shoulder aches and stuff. So I
Yeah.
just thought it comes with territory. And I was comfortable and absolutely fine with it. And he fixed it within a day. I used to go to the ERs to get injections and steroid injections and painkillers and whatnot for it. And I'd been managing it for about 6 to 7 years. But he fixed it overnight by giving me 3 scoops of protein because he observed my routine and he observed what I put in my body regularly. So
Yeah.
essentially, I was
Protein deficient.
devoid of or deficient in protein. So that's what he figured out, which was a simple fix.
Wow.
Nothing needed to be done, no doctors, nothing.
Yeah.
And then he made a few other changes which really optimized my life. But the biggest difference that was made in my life was I had been taking antidepressants, anti-anxiety, and PTSD medications for a decade. And I was absolutely fine with it, minimal dosage. I did have some side effects, but I was comfortable with it. I didn't even think about it in a daily life. But he put me on a supplement protocol, which essentially combined knowledge and nutrition from different alternative medicine modalities like TCM, functional medicine, Ayurveda, all of those amazing sources of knowledge. And he crafted a very personalized protocol for me. He optimized my daily habits, my lifestyle, changed the things and my ecosystem around me, not using plastics, all of those things. And based on that, he helped me get off of those medicines that I had been taking for a decade within 3 months. And I have not taken any of those meds for the last year.
That's
And I feel the best. I feel like a teenager.
Oh,
As much as I would like to think that I'm one, I do feel like one. So yes,
let me
was,
stop you there because you shared a lot
yeah.
of information. And first of all, congratulations, you know how to pick those men. That's good pick. My God, somebody who can fix you in just your back pain in a day, and then within 3 months take you off of all your medications that you've taken for 10 years. I mean, wow, wow, that's just incredible. It tells me, first of all, that it's really important to think outside of the box and to get educated, because sometimes, we are told, oh, you're going to have to do this for the rest of your life. But the thing is, things change at the speed of light now. And we see new companies, new systems, new products, new ways of thinking that can be life changing, just like what you experienced.
Absolutely. Yes.
Yeah.
Um, that experience, and he is, he's part of my family now, but I can't really give the exact same person to millions of people.
No.
I can't replicate him. So what I thought was, instead of facing that challenge, let us try to create an AI agent that essentially does just that. It incorporates all of these alternative sciences into one intelligent system and curates protocols for you, gives you suggestions about life, essentially having your own coach. And people have the power to decide whether I just want to go with functional medicine or I'm more invested in TCM, I want Eastern practices involved. Whatever you want, you can pick and choose instead of having to pay $500-600 per
Yeah.
consult to a practitioner. So
Yeah.
just wanted to build something that was accessible, cost effective, and something that stayed with you for a long period of time, and it helped you with consistency.
Yeah.
That's where the idea came from.
And that's a beautiful idea, because functional health is definitely a growing field where, there were so many gaps, and there's still so many gaps. So obviously you're filling a major gap here. It's almost a diagnosis, but you're also offering solutions, right?
Yes, I would refrain from using the word diagnosis for sure.
Okay.
We definitely try to optimize people's lifestyles as much as possible.
Okay.
And the basis is nutrition. Nutrition is the basis for every single thing that you need to change. And the minute you strengthen that foundation, other things added on top of that essentially have, a multifold effect. So that's where we start.
Yeah. Yes. And nutrition, that's the problem too, because then we're tackling a whole the food industry that is being disrupted right now. But their main focus is, of course, profit, 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 and give as much as food to the masses that has the most profit, and we don't really always think about health. And in this country, I think this is where we have the biggest challenge. It's here in the United States, right?
Absolutely. And right now is actually also a very, very interesting time to be transitioning into this. I'm sure there were people 10 years ago who were interested in these sciences as well, widespread. And there are people in different countries who
Yeah.
prefer to go through the alternative routes as opposed to, contemporary medicine. But right now is very interesting because a lot of things have changed post COVID.
Yeah.
Post COVID, people have become more aware about, they want to focus on their health.
Yeah.
A lot of technology has changed. Have wearables, like so many people wear different watches and rings where you can collect real-time data and actually give them recommendations based on that real-time data.
Yeah.
And most importantly, AI. I don't think I have to explain about that. That's self-explanatory. So I think all of these combined just give us like the right time to get started on this.
Absolutely. And timing is critical here, because, I mean, AetherLoop is really in the health tech platform, and coming out, like you said, at exactly the right time, where people, because of COVID, because of isolation, they have learned almost to self-medicate, because they have realized, well, I don't have a choice, or maybe a lot of them, they don't have insurance, and maybe they can't afford going to the doctor. So it opens doors to systems just like yours, where you can come to your platform, find the right environment, find the right information, first of all, and the right people to guide you to think differently, right?
Yep, absolutely.
Okay, all right, good. So you have led a diverse team across startups, large companies. So can you tell us about your team now? Who do you have on your team and the type of support that they offer? I think that would be important to know.
Yeah. I am extremely proud of the kind of team that we have right now. I couldn't be prouder. And very early on, I had some really, really great minds come together. And these are all people who've had personal experiences or some sort of run ins with not traditional medicine. So it's my team essentially comprises of a core engineering team. We have a CTO who has a background from Google, from Mineral AI. He's worked for decades in health tech and wellness tech previously. And then we have our data scientist as well. And that's an individual who already has had plethora of experience from Amazon, from Microsoft. These are folks who've been in engineering in their niche fields, machine learning and data science and software engineering, for more than decades. And they've had previous startup experiences, and they essentially believe in the cause, so they joined in. And then we also have a couple of other engineers who are working on development work as, all of us strategize and move along in the product. And then we have a stellar advisory team. I have people on my team that have been YC startup founders previously. They've exited Y Combinator companies, biotechnology companies previously. I have folks who've been investors, who are angel investors and are currently in the process of, advising different companies as well. Mm-hmm. And then most importantly, I have subject matter experts, which is where we wanted to start, because we can't build without the experts. So we have wonderful people on our team. Dr. Arno Kroner, we have, he is a functional medicine and traditional Chinese medicine doctor. And then we have other practitioners, with Ayurvedic practitioner, Dr. Boas. We have a clinic that we partnered with. And we didn't mean to. The intention was not to start out there. We were reaching out to them to see if they would, be interested in advising us, but they wanted to be a B2B partner, B2B2C partner with us, which was an added advantage. I'm not saying no to that. Yeah. So we have their team who's advising us as well. And that's Dr. Julie McGregor and, her team. And then we also have Evan, who's been part of the process right from the beginning. So yeah, we have about 14, active agents, all of them very, precisely involved, helping different aspects, be it GTM, marketing, technical, product roadmap. All of them have their own lanes, and they are amazing critiques as well wherever it's required. And that's what we are building with.
That's wonderful. Well, it is obvious that you have the right people to guide your clients and to provide them the information that they need, and that is also accurate information. That's really important. Yeah. So can you tell us about the process, Shivastuti? How does it work? The people come to your website. I mean, what's the process, and how long does it take for someone to really experience that change, that lasting change?
So we actually are going to be releasing our first MVP tomorrow. So you caught us at the exact right time. And right now the website essentially just offers the basics of who we are and in a sneak peek into us. But we started with the user right from the beginning. The minute I thought of this idea and this platform, the first thing I did was I talked to users. And even now, and going forward too, my intention is to at least talk to 2 to 3 different users at the minimum per week. Okay. And what that got us was 50 early adopters. So we already have 50 people who are signed up and ready to go. They'll be testing starting tomorrow. And how people can reach out is you can go to the website, the AetherLoop.com. It's pretty straightforward. It's the name of that company. Yeah. And then there's a contact button. There is a button on the main page as well, which helps you, just get in touch with and be an early adopter as well. Okay. So yeah, and our email is up there on the website too, in case you want to directly reach out and be part of a user study with us, which definitely helps us shape the direction of the product that we're building.
Okay, all right. And then is there a cost associated with that? People have to pay to be part of that user group?
Great question. Yeah. So we are actually offering 6 months free subscription for early adopters. So, and we really, really want, it's not about bringing 100,000 people in to test the app. It's about bringing the right audience in who are very passionate about this field, who want to optimize their health, who want to help us build a product that helps them optimize their health. So for us, that is more important. The right customer is more important. And People can come in. We have a 6-month subscription free. Ideally, the cost would be $9.99 per month, and a yearly subscription is $120. But it's free for the first 6 months for early adopters. We also have a blood testing fee. So the thing about blood testing is I'm a very lazy engineer. So for me, it was super important that the blood tests be done at home.
Yeah.
So we've partnered with a great testing laboratory that sends testing kits at home.
Wow.
And you can and they will guide you through a phlebotomist over a video call, and you can just do the test there at home. You can schedule a pickup. They pick it up. They push the results out. You will see it on the app.
Oh, wow.
So
very
that,
cool.
yeah.
Love that. Yeah.
Thank you. Yes.
Yeah, because I mean that's something that some people they just don't want, or they don't want to take the time to do it, or it's just a burden. So you've eliminated that burden right there. It's amazing.
Absolutely. Yes, that was the intention there. And yeah, and that blood test is going to cost you. There are two types.
Yeah.
You can do a single finger prick, or you can do a blood draw. Yeah. Both of them cost about $190 to $250. It is HSA, FSA covered, and you can definitely get the paperwork to get that done too. And for now, we're also offering free doctor's approval. So we're not just building out a protocol and giving it to you. The system allows a user to get that protocol reviewed by a practitioner. Good. And only then you get the final protocol. Oh, so we don't want to leave any gaps. We don't want to leave any place for error for any individual, till the point where we reach, a stage where we can say the AI has surpassed the humans. But I think even then, whoever is comfortable with wanting the additional, review by a practitioner, we definitely would.
Well, you don't want to have the medical community against you, for sure. So it's smart.
Absolutely, yeah.
It's smart to involve them. They have their value, for sure. So I mean, it looks like you have thought about everything. This is great. So if anyone is interested, then they can just go to your website. How many users are going to accept as part of this study, or the 6-month free trial? How many do you accept total?
Our target is about 200.
200?
So yes. And definitely we want to accept as many as possible, but for the free subscription, it's $200. And even then, after that, our average cost per annum for an individual is $210. It's for the whole year.
It's very, very affordable. Yeah, for sure.
So I feel like the benefit that you're getting, and it's not just the 3 things that I mentioned. We will be gradually rolling out a metrics dashboard. We'll be rolling out other features for accountability as well. We want to make sure that it's a one single ecosystem. And we have a few interesting things coming up too. We want to make sure you can buy the supplements that you want at the same place with discounted prices. So building a marketplace as well. So there are a lot of things down the pipe, but our main focus right now is to make sure we get the protocol part of it correct, and people can benefit from it right away.
Well, yeah, and I'm sure you're going to measure all of that, and those people are going to become probably your best ambassadors too.
I would actually I think that's the best form of marketing any company can get. Yes. When people vouch for the product and they don't want to live without it. They don't think too much about it, but they don't want to live without it.
Yeah, so. And if it changes their lives, they will want to speak about this, because that's something that you want to share. They want to have their friends and family. So, I mean, this type of experience, it spreads like fire. It really does.
Absolutely. Another thing we actually noticed in the process was a lot of practitioners that we are working with, or we talked to in this field, not the conventional medicine, but in this field where they have the alternative modalities, they face this problem of intake, because they have very elaborate intake forms, and they ask detailed questions about what kind of toxins you're exposed to, or what kind of food do you eat. Give me a detail about, pets that you have, which is normally not done in a conventional doctor's office. Mm-hmm. So their intake forms are very elaborate, and they were like, most of the times patients don't fill out this information. It is very important for us to make it extremely tailored for that individual. But if they don't fill it out, we just let it be. And some people don't turn up. I had a practitioner tell me that some people don't turn up to the appointment if you send these forms beforehand, because the intake takes about a couple of hours.
Yeah.
So I was like, that is also a problem we're trying to solve with this, because our intake will be more conversational. It will be timed. You can do it as you want to do it. You can take breaks, and it will be you won't have to answer all the questions. It will be questions that are relevant to you. So we're also trying to solve that problem for businesses, practitioners that way.
And
So
that's
yeah.
critical. I mean, obviously, you're a technologist. You understand user journey on websites, and that's important to make it as easy as possible. Otherwise, people won't do it.
Absolutely.
Yeah, yeah, good job. So, how do you see the future of your company now, and the future of health tech in general? How do you see that evolve in the next 5 years, knowing that not only we have AI, other emerging techs, quantum computing? What do you think is going to happen?
I was having this discussion with a friend of mine the other day. Actually, there's a very doomsday sort of a feeling where we think that it's going to be a very either it's going to be a utopian society where everybody gets universal basic income and you don't have to work at all and AI does everything for you,
Hey,
or it's going to be
yeah.
extremely bad where the machines take over. I'm somewhat in the middle. Any technology can be weaponized. So, and this was the case previously also. I know this one's much easier to do so. What I think is, as long as the pace at which we're making technology that is for the better is faster than the remainder, that's why I feel like more founders, more startup, CEOs, more people who are building new stuff need to jump onto this train and use this, and more companies need to use AI to build better tech for good,
Yep.
as opposed to using it for bad. The reason I feel that, and that's the reason I interact with a lot of founders as well, the reason I feel that is that will essentially create that utopian future that we're thinking about,
Mm,
especially in health tech.
yes, I
Especially in health tech, because I can see a lot of people focusing on very little minute niches of if somebody has bipolar disorders, they're building an app for that. If somebody has learning difficulties, they're building an app for that. All great things, but all things that need to be built on and jumped onto right away. So I feel like AI definitely is going to be, we have to understand how to wield it and how to use it, but we have to use it. You can't just stop, or you can't just put your weapons down and be like, no,
I
not
think
doing it.
I think yeah, you don't have a choice. When I hear people tell me, "Oh, I am going to wait," well, you can't wait. You're going to be surpassed by your competition. You are wasting time that you don't have to waste because AI is saving so much time, and maybe you get ideas and open up doors to new creative solutions that maybe you didn't think of because you didn't have that option. So, I think it's so smart to just embrace it. It's inevitable anyway. And I really believe that that utopian future that you're talking about is very possible. Why not? I
Yeah.
mean, I am an eternal optimist. I think we are shifting now. The world is shifting. The universal consciousness is evolving in ways like never before, and we have to adjust. We have to adapt and think differently. And maybe we don't have to work 80 hours every week. Maybe there's another option, and I'm totally okay with that. Seriously.
I strongly feel AI particularly will help humans be more human. I
Yes.
think that we have devoted so much of our time, that me included, into doing what we think is the best
Yeah.
way to use our time, corporate jobs, 9 to 5, and
Yeah.
just A to B, that's it. That we haven't thought about our spirituality, evolving as a human being, consciousness, to use your word, and how to make things and how to not make things worse on earth. So all of those things can be prioritized now that AI can do all of the other mundane jobs that we
I,
focused on.
I
So
agree with you. I'm very excited about what's coming. I think it's going to be very positive. We're going to have some people that will fight against it for sure. But I think a lot of the old thinkers, they'll be forced to change, or they will disappear and leave space to new ways of living because it's about time. I really do believe that.
yeah. So
Great. So, if you had one piece of advice you would give to aspiring technologists who want to make a real impact through accessibility or health tech, or doing something that combines maybe medicine with tech, what would that be?
um this is something I've learned over the years. And I have to reinforce every day into myself too. 99.9% of the problems are not real problems.
Mm,
When you are a founder, they're not things that should rattle you or you should get emotional about or stressed about. That doesn't mean that you can't feel things. That's an individual, obviously,
yeah,
feelings you're entitled to.
right.
Just be as tenacious as possible try to develop that muscle and be as tenacious as possible, because the things you need to fret about are probably in that 0.1%, where you have to, it's fire burning in the
Yeah.
entire forest, and it's really, and you have to be stressed about. Startups is all about stress for sure, but I think 99.9% of the problems are, they have a solution, so it's not that bad. And developing that tenacity is the key to everything. You will fail a million times, but you just need to succeed that one time to move forward.
This
So
is so beautiful. And I think this is a word, I'm going to put it in the video in big: tenacity. Don't give up so quickly. And I think it's something that maybe ultra developed countries have a tendency to do a lot faster than developing countries that have, I think, endured maybe different things in life, and that have more tenacity because there is survival at stake, whereas our survival may not be at the same level. And I think it's a word that I absolutely love, that I needed to hear today. So thank you so much for that, because you're right. It's a choice. It's a mental choice to say, it's okay. It's a problem I can solve. And like you say, 99.9% of the problems can actually be solved, but only if you have the right mindset. If you don't have the right mindset, that's not going to happen, right?
right, that's correct.
It's beautiful. Wow, it's just such an honor to have met you and to witness what you're doing here with the AetherLoop. Thank you so very much, Shivastuti. Is there anything else that you would like to add and share with my audience today?
I would love for people to just reach out and connect. If you have any feedback about, in what would you want as a product, I would love to talk to people who are interested in biohacking and see what we can do, for them, and how we can make this journey easy for them. And yeah, just reach out. I'm open to communication. And yeah, just reach out. That's what I
Perfect.
would.
So what's the best way to get hold of you?
I'm definitely available on LinkedIn. So it goes by the name Shivastuti Koul. And I do have our company email on the website as well. Our company website is theaetherloop.com. And yeah, I'm pretty active on LinkedIn. I think that's the main source where people can reach out.
That's a good source. Perfect. Thank you so very much for being here with us at the Leaders Uncut podcast today. It was a great honor. Thank you.
Thank you so much for having me, and thank you so much for such an insightful conversation too, Catherine.
Yeah, wonderful. Thank you everyone for watching. I'm sure, not I hope, I'm sure you enjoyed this conversation. I'm sure you learned something that is critical and maybe that you can use with your own health. But if you don't want to use it with your own health, please share this video that will be published on YouTube and on LinkedIn. Share it with your network, because I'm sure you're going to have lots of people that want to experience something else, that want to find solutions for what they are going through right now, health-wise, and that they can't handle on their own, or they're not finding the right advice or the right medication. It can be life-saving. So make sure that you do that. It's not just about you. It's about, hey, what can I do for others? And that could be something that, like I said, could be life-changing. So please share. That would be very helpful. And also, don't forget to subscribe to this channel. I need you to help me out here, continue what I'm doing. I could not do it without you. So I count on you to do that, and give it a like if you like it. And I can't wait to see you next time.